The UK's top scientist, Sir Patrick Vallance, warned that further restrictions would probably be needed in more areas. In England at present, some 17 million people are under Tier 4 rules. That's the highest level where people are being told to stay at home and not to leave the area. Scotland is moving into its highest alert level 4 on Boxing Day. Northern Ireland will begin a lockdown on the same day. Wales, where the NHS is under great pressure, has already entered a new national lockdown. Our health editor Hugh Pym has the latest.
Which way are we going? Into safe.
On the NHS front line in South Wales, at Morriston Hospital in Swansea, there's been a surge in COVID patients and the virus is said to be running rampant in local communities. This footage and interviews with patients were provided by the local health board.
Very scared. I've never been so scared in all my life. And I'm off oxygen, feeling stronger all the time, you know. Still quite emotional. It's frightening to me.
People don't realise what's going on in here. If you don't see it firsthand, they won't know. They think everything's hunky-dory. It's not. Some people don't take this seriously.
All the UK's nations have come up with new restrictions to try to curb the spread of the virus. City streets are a lot quieter. There's speculation in England now over whether tough measures might be extended more widely. This map shows the tier system in England. The dark red area, London and the South East, is in Tier 4 with the toughest restrictions because of the spread of the variant of the virus. Orange shows those parts of England in Tier 2, some of which are bordering that Tier 4 block. Now, in terms of cases per 100,000 people, the blue line shows what's been happening in the Tier 2 areas furthest away from the South East, for example in the north of England, and cases have gone up a bit since early December. But the red line shows what's been happening in Tier 2 areas closest to the South East and Tier 4, and you can see infections have gone up a lot since early December. Some communities are split down the middle between Tier 2 and Tier 4, and the virus with the new variant doesn't respect boundaries. There have been calls for every area to be put on the same footing.
I actually think the whole country needs to be in Tier 4 because we have to get ahead of it, and we're not ahead of it. Right now, we're behind it. And hospital admissions, for instance, are like shooting up in the south, and they're not yet in the north, and we just don't want to see it happen everywhere.
There have been warnings, though, that further lockdowns might be damaging for people's well-being.
We know from the first lockdown how important it is for people to get the support that they need, and also the implications of lockdown for people's mental health and the implications of not getting that support.
As pressure on hospitals intensifies, questions have been asked about why the Nightingale hospitals are not being put to greater use. This one in Exeter is the only one currently taking COVID patients. Senior specialists say it's all a question of staffing.
It's very easy to create space and to buy equipment and drugs, but what you can't do is create a highly skilled member of staff who can work in critical care at short notice. And the only way, even back in April, the only way we would have staffed the critical care in the Nightingale hospitals is by diluting staff in the NHS.
NHS England says the Nightingales are a backstop and will be used if required. That, some might say, could be sooner rather than later. Hugh Pym, BBC News.
We'll talk to Hugh in just a moment. Before that, let's have a look at the latest government figures. There were 36,804 new coronavirus infections recorded in the latest 24-hour period. The average number of new cases reported per day in the past week is now 31,743. 1,909 people have been admitted to hospital on average each day. 691 deaths were reported, that's people who died within 28 days of a positive COVID test. And it means on average in the past week, 486 deaths were announced every day. And it takes the total number of deaths so far across the UK to 68,307. So, as promised, Hugh is here, our health editor, Hugh Pym. Can we talk about the pressure to bring restrictions to a higher level in far more parts of the UK, Hugh? Where is that debate now?
Well, Hugh, in Whitehall tonight, there's been an intense debate on a committee of health ministers and officials about what to do about the tier restrictions in England. Their recommendations will go to a cabinet committee tomorrow morning, and then there'll be an announcement. And there is intense speculation that Tier 4, the toughest restrictions, will be moved out a bit to a few other areas of southern England. But also, very possibly, some areas currently on Tier 2 elsewhere in England being moved up to Tier 3. And that involves pubs, bars and restaurants having to close apart from takeaways and delivery. So there could be quite a lot that affects people in that. In Scotland, the government is looking at its restrictions to take effect on Boxing Day, when the whole of mainland Scotland moves into its highest level, level 4, curtailing retail and what's allowed to open, and even looking at the legal backing for getting people to stay at home if at all possible. Now, the backdrop to all this is this surge in cases, a 61% increase week on week around the UK. Hospital admissions up 18%, and the total number of patients with COVID in UK hospitals now nearly 19,000, not very far off the peak seen in April. So the NHS is going to be very busy right through Christmas and beyond, and I think ministers and officials will be, as they work really hard to try to find means of curtailing this virus.
Hugh, once again, many thanks. Hugh Pym, our health editor there. As we've heard, leading scientists say that they have high confidence that the new variant of the virus is easier to transmit than other variants. But there are many unanswered questions about the characteristics of the new variant and how it's managed to become the dominant strain within just a matter of months. Our science editor, David Shukman, has this analysis.
It takes scientific detective work to discover the genetic clues about how the virus is changing. The UK does more of this than any other country. Maybe that's why the new variant was spotted here first. In any event, scientists say it does seem to cause infections more easily, and it is now spreading. This map, based on the latest data, shows how the new variant has been found across most of the UK, and it's got to other countries too. Confirmed in the Netherlands, Denmark and Italy, and it's probably in Germany and further afield. Australia has found it as well. Researchers say the new variant may become the dominant form of the virus.
At the moment, the trajectory is clearly that this is increasing extremely rapidly. We have seen this before, so we saw a variant which emerged in January, becoming dominant form in the earlier part of this year. And what we're seeing with this new variant is that it's actually increasing far more rapidly than that previous variant ever did.
A crucial question is whether the vaccines can handle the new variant. Everything so far suggests they will. The scientists behind the Pfizer-BioNTech vaccine say tests on other mutations have proved that.
We are confident that this will be the case, since in the past we have tested more than 20 virus variants with different type of mutations, and the result was always that the vaccine induces an immune response which is so broad that it attacks multiple positions in this virus protein.
And what does the new variant mean for when we'll get out of this crisis? Well, one estimate for the UK says the most vulnerable people and healthcare workers may be immunised by the middle of next April if everything goes according to plan, and 67% of the entire population by mid-July. That would achieve what's called herd immunity, basically when the virus can't spread much more. But because the new variant seems to infect people more easily, it could be that 80% of the population has to be vaccinated to achieve that herd immunity, and that would take longer, maybe running into next August. Another concern is whether children are more at risk from the new variant. There's no firm evidence of that so far, but scientists are watching closely. And from the labs that found the variant, a message has been relayed by the World Health Organization to make sure that when every country tests for the virus, they can detect the new version. David Shukman, BBC News.